Hello, how are you?
Hi, I'm fine. And yourself?
I'm doing pretty well. Thank you for asking.
Mhm.
So, my name is Courtney Henry, and I'm a pharmacy student. And the reason for today's visit is so, therefore, I can go over, or shall I say, we can go over and discuss the current medications that you are taking. Do you
Okay.
have time to discuss those things with me?
Yeah, that's fine.
All right, cool. All right, so just to make sure I'm talking to the correct person, I am talking to Usaro Omufawam.
Yes, you are.
All right. Can you give me your date of birth, please?
7/4/1992.
7/4/1992. Okay. What pharmacy do you prefer to use?
I go to the Walmart pharmacy,
The Walmart. Which location?
the one in Marrero.
Okay. And I'm pretty sure you probably don't know the number, but I can look that up just by the location that you gave me. Okay.
Okay.
All right. Are you allergic to any medications?
Yes, penicillin. I had a rash as a child, so
Penicillin.
yeah.
Is that the only one?
Yes, that's it.
You said it caused you to have a rash.
Right.
Well, we don't want you to say penicillin because we don't want
No.
you to be uncomfortable. All right. Do you have any allergies to any food items?
No, I do not.
No. Oh, lucky you. Lucky you. That's good. All right. So I want you to go through all the medications, prescribed medications that you are currently taking. Okay.
Okay.
You can list them one by one. I want to make sure that what I have on file matches what you're currently taking. Okay.
All right. Okay.
Okay. You could begin.
Okay. So I take metformin,
Mm-hmm. Metformin.
lisinopril,
Mm-hmm.
and citalopram.
Citalopram. All right. So for the metformin, why are you taking that particular medication?
I'm taking metformin for my type 2 diabetes.
Okay. What's the dosage form?
500 milligrams.
500 milligrams. How often do you take this medication?
I take this twice daily with the meals.
Twice daily with meals.
Yes,
Have you been able to keep up with this particular drug, taking it?
yes, I have.
So you haven't missed any dosages in the last month?
No, man.
Okay. Very good job.
Mhm.
All right. You said you're taking lisinopril, correct?
Yes,
Okay. And why are you taking lisinopril?
for my high blood pressure.
For your high blood pressure. Well, how are you feeling right now?
Well, I'm feeling fine. I'm feeling
You
great.
feeling fine? Well, that's
Yeah.
good. We hope that we're gonna try to keep you feeling fine.
Mhm.
What's the dosage on that lisinopril?
10 milligrams.
10 milligrams. And how often do you take that 10 milligram?
And I take this once a day in the morning.
Once a day in the morning.
Yes.
You're not having any problem with lisinopril?
No, I'm not.
No. Okay. Missed any dosages within the last month?
No, I haven't.
No. Okay. So far so good. And so right now you got a 2 out of 3. That's good. And what's the last drug? Could you name it one more time for me?
Citalopram.
Citalopram. Thank you. And why are you taking citalopram?
I'm taking that for my depression.
Depression. Okay. What's the dosage form on that one?
10 milligrams.
10 milligrams. How many times?
I take that once a day in the morning.
Once a day in the morning. Any missed dosages?
No, not that I can recall.
All right, so we 3 for 3. So I want to ask you a question.
Okay.
How are you able to keep up with these medications? Because you said that you haven't missed any of the dosages, which is very commendable.
Well, I normally have my calendar that I write all this in to take my medication to remind me in order for me to take it. So yeah,
Okay, so like you're using technology like the phones and stuff
yeah,
like
like my
that.
phone, like my cell phone. Yeah.
Okay, I'm so old school. I'm gonna get that one day, but those phones are definitely really good tools to use,
Yes, they are.
especially for, you know, alarms to remind us. So
Right.
that's good. I'm proud of you. That's really good. All right, now I do have to ask a personal question, but
Mhm.
it's standard. Have you ever used any illicit drugs?
No, I have not.
No, you have not. Okay, pretty cool. Do you drink or do you smoke?
No.
No, no drinking, no smoking. Okay. Do you exercise daily?
Uh, I try to, but not as often.
So, how often would you say you work out within a week?
Maybe once a week.
Once a week? Okay. Well, with that metformin and those type 2 diabetes, you know that diet and exercise plays a huge role in that. And the goal is to, to decrease your medication and
Right.
prayerfully eventually, get you off the medication.
Right.
So let's try to increase that exercise to about maybe 2 times a week.
Right.
And just I
Okay.
want you to let me know how that goes and how it feels for you. And then we can
Okay.
go from there. Okay.
That sounds good.
Okay. Let's talk about your diet. I want you to give me a rough draft of what you normally would eat in a day, starting with breakfast and ending with dinner. And please include any snacks if you do snack.
All right. So in the morning, I'll fix me some pancakes, sausages, and maybe some eggs. Um, at lunch, I'll probably eat like a sandwich and like a candy bar and have a Coke to drink. And then dinner, I'd probably go out and give me something to eat, maybe like Popeyes or Cane's. And yeah, that about sums up my diet.
Okay, so it's really great that you're eating frequently.
Mm,
You know, you're eating 3 times a day, but keeping in mind that you have, your medication for your high blood pressure and your diabetes, we want to also try to utilize other tools to help you as well as, or to help the medication work more effectively, if that makes sense. So for breakfast, if you can, I understand you're really busy. Try to pick something that's healthier or more of a healthier choice that's kind of quick. So something like a piece of fruit, like a banana or orange, or even an apple, or maybe
okay.
something quick like oatmeal. You know,
Okay.
and even oatmeal, it also helps with lowering cholesterol. Okay,
Right.
so that's also a very quick meal that you can eat.
Okay.
Now, when it comes down to your lunch and your dinner, it's kind of the same. There's nothing per se wrong with it, but I would like you to incorporate some form of a healthy option. So try to incorporate a fresh vegetable if you can.
Okay.
Okay. And I'm be honest, we gotta minimize the fast food.
Right. Right. I'm trying, but it's hard.
It's okay. We're gonna take it one step at a time, but we're gonna get there. All right. So what I want you to do is I want you to repeat the options that I just, or the suggestions that I just gave you when it comes down to your eating. So what
Well,
are we gonna like try to work on?
you wanted me to change my diet. You wanted me to eat more vegetables. You wanted me to exercise twice a day, and maybe eat some fruit, incorporate some fruit into my diet. So
All right. Good job. Now, are there any questions that you have for me pertaining to anything that we discussed, whether it's your prescribed drugs or more about your diet or any suggestions that you want me to give to you?
no, ma'am. I think you covered everything.
Okay, then. Well, if you don't have any more questions and we're going to actually start to implement these new things, always feel free to call me or to come and see me, okay? And let me know about
Okay,
your progress.
I definitely will.
All right, it was good to see you.
Thank you so much.
You're welcome. See you later.
All righty. Bye.
Bye.